everybody. I am Mathumita Sahu. I am just 41 years age now. Before I have headache, but very before I could not guess what is this headache, eye pain, something eyes problem or like that. When I was 21 years, 22 years, I got some headache. And after marriage, every time I used to say to my husband that what is in your head? Every time you are getting headache, you are telling like that. Very before when I am my childhood, if fever also come, I didn't get any headache. But after 21, 22 like that, I got little headache. But first time I got headache both sides, means total headache. And after that sometimes then I used to go to doctor. Then he asked me every time, you are getting one side headache or both side. But that time I got both full headache. Means after that I am getting some nausea, vomiting. If water also I can drink, that I am feeling vomiting like. And after sometimes I mark that some zigzag lining and black and something, means vertigo like that, all mixed type or something, very bad type headache, very aggressiveness. And if that time some sounds or lights come, then my headache is very precipitated very highly. So after that I used some medicine. Very last 20 years I am changing the medicine, using dose to dose. Then again from Delhi, RML, then Kotak also, SC Medical, so many. I came to Rasalkhama back 7-8 years, but that time I used medicines also only on 1-2 painkiller, 3 painkillers. But my painkillers day to day, I use more painkillers, and I got stomach pain also from that painkillers. So my husband said, Dr. Sweta, neurologist, I met her, and after meeting, she said me, we will start the injection. And I started that injection. That 1 month some injection was there before. That is painful, but for me it could happen 30-40% relaxations. But after then she changed my injection, the 3 months duration injections. Getting that injections, I got relaxation 50-60%. And many important things is that after meeting Dr. Sweta, I got now little happiness, and my life changes. I do medications like that also, and I got relaxed. And once I could thought that I can live also more. One point of life was that, because I thought I can live, I can enjoy my life. Because headache in my life now, no problem at all. But one problem is that headache. Even night I am sleeping, morning when I get up, that time I get up with my headache, migraine, one side. Now it is totally half one side, and aggressiveness also, because last through 3 months this aggressiveness very less, and no nausea, no vomiting, no zigzag blackness. Little periods time it may 1 day, 2 days, but now no nausea, no vomiting, no zigzag, only headache. And this headache is again not one side current headache. This is the something pressuring headache. And when I am using this Cephali also, I am using little night time when I am getting the headache. But nowadays I am getting relaxations and feeling happy also.
Mathumita Sahu was suffering from long-standing migraine, what we call chronic migraine. When you suffer more than 15 days in a month's period for over a long period of time, that is chronic migraine. And once you are suffering from chronic migraine, you spend most days in the month suffering from the pain. She described how she had aura, the zigzag lines, the nausea, vomiting, how lights used to trouble her, how sounds used to trouble her. These are all the symptoms of migraine with aura. If you suffer from headache, it is very important to understand the symptoms. Again, I would repeat, not every headache is a migraine. Migraine definitely has headache, but also has these bothersome symptoms, particularly the half-sided headache, nausea, vomiting, light intolerance, sound intolerance, and sometimes the trigger factors are smell or chocolates or not sleeping on time, not eating on time, and other factors as well. For Mathumita, she had been to multiple hospitals, multiple places. She's from India and she had tried a few medications also, as she talked about a lot of other therapies which she was already taking, which was not helping her. In fact, for her, we had started with this injection which also did not work, and that can be the case which is possible for a patient when you're treating very chronic resistant type of migraines. So we changed her to an intravenous or IV kind of injection which she will take every 3 months, which is called Vyepti or Eptinizumab. That is the molecule, the anti-CGRP, which we talked about. So she did not get benefit from one, but she did get benefit from the other class in the same, from the other molecule in the same class. So what happens is, it's very important for us as clinicians and as patients to work together. And of course, she's monitoring her pain diary, she's maintaining a headache record, she's maintaining and doing all the other things which are required as well. So Mathumita is a classical example where if you suffer from very long acting chronic migraine, you need sometimes 1 or 2 strategies, out of which one can work very well. I wish again such patients luck, and especially very important that you can come to us and we can help you out, figure out what kind of medication would work best for your migraine. Thank you.